This is Anila Simon, and I hope you guys can hear me properly and see me properly. Can somebody type in here that you are able to see me and hear me? Binitu, can you hear me? Okay, all right, good. Thank you. So, hi. So, I have seen that this is actually an open invitation to all kind of class, which means it's not just the members, who are here today. We usually have these sessions every Friday, 8 p.m. Only for the members, the comprehensive course members. But I do, at least once in a month, I try to do an open invitation to all the public. And today is such a day, and I know that there's a lot of people who are not familiar with our live classes before, or maybe don't know me. So I just wanted to introduce myself. This is Anila Simon, and I'm the educator with AppleRN Coaching, and I'm very happy that you're here today. Now, you will have to excuse me. I'm just going to say something here, and that is Onashamsagal to everybody. Today is a very special day in my state. I'm from Kerala in India, and today is Tiruvonam, which is a very grand festival. So I just wanted to wish everybody the happiness and the prosperous life of today and for the year ahead. So തിരുവോണ ആശംസകൾ എല്ലാവർക്കും. Okay, and happy Onam. All right, so let's go back to our live class today, because there's a lot of other people who don't speak the language, and also there's a lot of people from other countries, so I don't want them to wonder what's going on. So let's start today. All right, okay, happy Onam. All right. So today we are going to do with mental health concepts, and very important in NCLEX RN. And before we go into detail on that, there is something I would really like to specify, because there was a lot of questions and concerns from the students about the changes which are going to happen in next year, because most of you probably are aware about that every 3 years NCLEX is going to kind of review how things are, and they might change the passing standard, or they might change the question structure. So there's a lot going on, and we had an episode of revision in 2013. The passing standard was taken from here to here. So many people find it so difficult to pass the exam compared to 2010. And then in 2016, the passing standard remained the same. Okay, but there was a little kind of changes in which percentage, of questions coming from what area. So that was a little different. So as of now, we are following the 2016 update. All right. So the next one is coming in 2019. It's going to be in April. March, April is the time when it changes, but it's going to be mostly in April. And we don't know anything officially yet. Okay. But the things which I have gathered, I can share it with you. And, it's possible that things are going to change. Now, I'm saying this in an unofficial way. We don't have any intimation. NCLEX has been saying that they are still reviewing and will let us know if there is any changes. So as of now, don't know anything official, but unofficially, what I think from my experience is that there will be a change. Okay, so there is a possible change in April 2019. But one thing they have informed us for clearly that it is going to change is this. The entry level is going to be 12 months. Okay, it used to be 6 months. And for those of you who does not understand what entry level is, NCLEX takes the survey of people who actually pass the RN and is graduating, or new graduate who actually do their first 6 months of nursing job in US. So NCLEX survey them. So the new nurses who are only 6 months of experience, NCLEX survey them, and they are going to take up their information from these people, and that's the basis of the question difficulty level. So your questions in NCLEX exam, which you are getting now, are based on the understanding of a new nurse with 6 months of experience. Okay, that's what I'm trying to tell you. Now, they are going to change that in 2019 April. This is official, okay, it's there, it's official, that they are going to change that from 6 months to 12 months. So instead of being the questions based on a 6-month experienced new graduate, it's going to be on the basis of a 12-month experienced new graduate. Does that make any bell to you? Does it ring any bell? Which means, which I think it is going to be harder, right? Because if there were questions which were only on 6 months based experience, now you're asking the double of that, which means 12-month experience, obviously it's going to be harder, okay? I mean, that's just me saying this, all right? So I will let you think about it and see what it means, okay? But from my experience or from the knowledge I have or the information I have gathered, I think it's going to be a little more difficult when they change it, if they change it in 2019. I'm not sure about the passing standard. We don't have any information yet, but they haven't changed it last time. So there is a higher chance that they are going to change it this time. Okay. Now, if they change it, it's not going to be lower. That I can tell you, it's going to be higher. So what I'm trying to tell you here is, if you are trying to pass this exam, you better do it before the changes happen, if you can. Now, nursing content is going to be the same, okay? I mean, whether it is this year, next year, the next year, the nursing content theoretical knowledge is going to be the same, right? I mean, nursing is the same everywhere, whatever happens. Maybe there is some evidence-based practices which are going to change, but the fundamental concepts are going to remain the same. But the critical thinking and what you are supposed to be doing are going to be different. And the questions you are going to get is not going to be on the theory bookish knowledge, okay? And those of you who have already written the exam before understand what I am saying. You are not going to see any question directly from the book. It is going to be mostly application and analysis question where you have to connect the dots, and that's what I always tell in the class, right? Connect the dots, critical thinking. That's why people who just have a book in their hand and review everything and any textbook, just learn from the textbook only, are not going to make it, because theory is only halfway. Okay, you need theory, that's good, but that is going to get you only halfway. You need to learn to apply that. Okay, that comes by connecting the dots, that comes by making that complete picture, that comes by application and analysis in critical thinking. All right, that's what you need to learn. That's important for you. Okay, and that's what I try to teach you, right? And those of you who are my students already will understand what I am saying, because I can see the difference in people's thinking. I mean, when they come, when they start, they are so naive, and then from there it just, clicks. Oh yeah, that's right. Yeah, that's right. And then they start connecting the dots and making that picture. And that is the best thing you can learn from any course. So anywhere you get that, go for it. Okay? And that will be the best thing for you to do. All right, guys. So that's one thing. Another thing I wanted to tell you is, whenever historically, which means in the past, anytime NCLEX change the passing standard, the pass rate goes down, which means whenever they change or increase the passing standard, they have always increased the passing standard. There was no time which I know that they decreased it. So that's why I'm saying, if there is a change, it's good. The passing standard is going to go from here to here. Okay, which means it's going to be a tough climb. Okay, so every time they change it, so many people fail because they don't know how to apply that knowledge. All right, so it's going to be there from 2019 April. So prepare yourself better for that. Okay, and the structure, most probably it's going to change question structure. As of now, we have alternative questions, right? I mean, we have SATA, select all that apply questions. We have multiple choice, I mean, which is the same as select all that apply questions. And there are filling the blanks, but usually the filling the blanks are medication calculations, right? But you will have different kind of possibly, okay? Now, this is under research yet. So we don't know if that's going to be how much percentage. We are not sure yet. Anyway, I'm going to North Carolina next month for the NCLEX conference. And inshallah, I mean, we will be there. So the NCLEX is directly giving us, information through the NCLEX conference. So I will be there, and if I get to know anything, I will let you know. All right. So that's why I'm going there, to learn more about how these changes are going to happen, what kind of questions or what structures are going to be there. And I'm hoping that I will be getting more information and I will pass on to my students. All right. Okay. So be prepared and study well. And if you look at the AppleRN course, you have everything you need right there, including the critical thinking and the questions and the theory and everything included. And you get live classes, like these ones every Friday, 8 p.m. Central CST. Okay, that's the Chicago, Houston time. So I will see you guys. All right, so let's get started. And today, first of all, we are going to do a question. Okay, now I want you to try to kind of read through the question, see if you can figure out what's the answer, and I will give you a poll. Now I'm explaining this because there are people who have not been here before. So you're going to get something like this. Okay, so for every question, we'll be giving something like this, and what you do is you click on whichever you think is the right answer, A, B, C, or D. Okay, and there will be a small button which says send. I think in the fonts it says that. So just press on that send and it will come to me. Now, I would definitely encourage you to do it, okay? Because action is what makes you successful, not knowledge. You have to apply it. So this is one thing that where you can make mistake without any problem, because nobody is going to see your name. All right, nobody is going to see your name. Just click on it and send me the answer, and I will see how that goes. All right, so this is the first question, and let's do this together. And we will see that if we will discuss this in this topic or this concept later, but I just want you to try to get an answer for this first. Okay. So the charge nurse is making room assignment for a 9-year-old child with autism. Which is the most important nursing action? Now, another thing I would like you to know is that for your NCLEX exam, you will have these strategic words bold. Okay, so in this one, the strategic word is most important. So you will have that in bold, okay, in like big, thick kind of thing. So you should pay attention to that. A, placing the child in a private room near the nurse's station. B, placing the child in a private room near the kids' play area. C, placing the child in a semi-private room with another child with autism spectrum disorder. D, placing the child in a private room at the end of the hallway. Okay. I will give you a minute to go through this, and always try to make a decision with your given information around in 2 minutes. Okay, there is no time limit. You can go from up to 6 hours in NCLEX, but my suggestion is to get kind of used to doing it in 2 minutes, because that's a good time for you to read the question, read the answers, come up with an answer. If you overthink, there is a higher chance that you are going to select from your right answer to wrong answer. So no overthinking. Okay, so try to kind of familiarize yourself in making it in 2 minutes. and that's going to be really helpful for you. Immaculate, do not, please don't type in here. Don't type in there. I'm going to give you the survey, and that's what you are going to do. Okay? Because when you type in here, people can see it, and I don't want anybody to see it. Okay? I don't want anybody to get influenced by the answers you have been giving. So this is where you are going to answer. Right? Go ahead and answer it. Okay, it's fine. This is the best way you can learn. I can tell you from all the live classes I have done, people who actually click and answer remember it more, and they remember it longer, okay, compared to the people who does not answer. I mean, that's the truth. So if you want to get the best out of this session, go ahead and do your best. All right, just click your answer. And like I said, nobody's going to see it. Okay, all right. So we have around 80%, 82% of the people answered. So there are still about 20% of the people who hasn't answered. And I guess I'm not going to wait any longer. So most of the people, that means about 40%, 41% now is saying it's A. Okay, there are 12% saying it's B, 20% saying either it's C or D. Okay, so now it's 44. So about 44% of the people are saying it's A is the answer. That means placing the child in a private room near the nurse station. I'm not going to say this is right or wrong. I want to come back to this question later. But first, I want you to know what autism spectrum disorder is. So I'm going to teach you from the class. This is we learn about this in mental health. Okay, it's there in the course. Okay, and in the days in 30, 31, and those are the days on 33. We have 1 week, only for mental health, and because it's a very important concept. So what I'm going to do is we are going to have a little conversation on autism spectrum disorder. Now I'm going to teach you this, then we will go back and see if your answer is right or wrong. Okay. Now, first of all, what you need to know about autism is it's not just one thing. Okay. I'm not sure if you have seen anybody with autism. I don't know if you have anybody in the family or friends or in the community that you are aware about a child being autism, because most of the time the autism is more like a childhood problem too. So if you know someone like that, you can understand what I am saying. Okay, and there is a genetic component, so it's very common in siblings. Okay, and it's a spectrum disorder, which means it's not like diabetes or hypertension or heart failure. All right, it's not like where you can say, okay, this is anemia because the hemoglobin is less than 10. That's anemia. But autism is not like that. It's a spectrum. Okay, when we say spectrum, think about the rainbow. I want you to think about rainbow when we talk about autism, because the rainbow is a spectrum of disorder. I mean, spectrum of colors, right? I mean, do you know exactly where the red ends and the other color begins? No, it's kind of merging into one another color, right? That's how rainbow is. Even though we try to make boundaries and color them and stuff, but actually if you look at it, it's a spectrum of colors. Right? You don't know where one starts and where the other ends. And you have this color difference from red to yellow to indigo to, all the colors in the rainbow. So that's how it is in autism spectrum disorder too. You can have a child with an autism spectrum disorder spread open on the, like a wide range. Some people may be very, very end, like in the end of it. Someone will be in the beginning of it. It depends. Okay, and you won't be able to say where this beginning one ends and where the other one starts. No idea. It depends on the clinical manifestations of the children. All right, but there is research shows that there is a genetic component, so it's always it's possible that siblings have autism together. If somebody has it, their siblings might have. Okay. Now in America, you might think that this is something like extraordinary. Maybe if you are not familiar with it, I used to think like that because I have never seen someone with autism, in my family or in my friend circle. So I had no idea until I started learning about it. In fact, 1 in 59 children in America can have autism spectrum disorder. And that is very, very high incidence, right? And it's more common in male, I mean in boys compared to girls. I don't know exactly how. I think 1 in 37 or something in boys, and 1 in 155 or 157 or something in females. But like I said, it's not that scare or something. I mean, it's not that rare. It's like it's more possible that people have, or the children have, autism spectrum disorder. All right. And so children, what happens here is children exhibit sensory processing problems. When we say senses, I want you to think about, what are our five senses? The vision, right? Vision, hearing, right? Smelling or olfactory, smelling, and taste, right? Like when we choose something, we taste, that's a sense. And then feeling or touching, right? So those are our five senses. So in autism, or autism spectrum disorder, most of the time the children are going to have problems with the sensory processing. Okay, they are going to be very hyper or hypersensitive to sounds, lights, movements, touch, taste, and smells. Okay, I happened to talk to a mother whose child has autism. So what she told me is that, if, first of all, she told me not to try to touch the baby. Okay, because he was hypersensitive to the feelings of touch. If you touch, how we touch baby, we simply, very softly we touch them. But for this boy, okay, if I do that, he will throw like a fit, like seizures. He was like, it was as if I'm like slapping him. He feels like that. Even though I touch him very gently, very softly, because of his sensory processing problem, okay, this gentle touch is, he's going to feel like I'm like slapping him. It's that painful. Okay, I have huge respect for the parents and caregivers who takes care of these children. Huge respect. I mean, I don't know how I will deal with that. Okay, I'm like 100% like, oh my God. I mean, this is they have to be truly blessed. Okay. So that's something I wanted to remember. So these babies or these children can be hyper or hypo. You might have seen, probably in the movies or something, maybe you have seen that some of the children are mute. Mute means they won't talk, right? So they kind of seal themselves from all the sensory inputs, and they don't talk, they don't look at you. They'll be always looking at this and sitting like this, and they won't move. You might have children like that. They also have autism, but it's like a spectrum. Some of them will be like throwing a tantrum, may have even seizures. Okay, so next time you see a baby or a mother like that, don't judge. Okay, because you never know what they are going through. All right, be supportive. All right, so that's something I wanted you to remember. So they might be hypo or hyperactive, and most of them are hyperactive, so they need a very, very calming environment. Okay, minimal stimulation. I mean, if you can make somebody away from all the disturbances, the noise, the light, and everything which is going on, try to keep them away from all that. They need a calm environment. Okay, remember that. A quiet or monotone voice. If you are a nurse going to take care of this baby, when you go there, when you go to the baby or to the child, with autism, this is how you should be acting. You should be going slowly. You should be walking slowly. Don't rush, don't hush, because that's too much. They will get frightened by your actions. Okay, you will frighten them if you do that. So go very slow. Okay, use eye contact and gestures very carefully. Do not look at the eyes and talk to them like this. They won't be able to take that. That's too much for them. Okay, I know you mean well, but that will be too much for them. So keep it very, very positive, very soft. All right, don't use your hands like I do. Okay, I mean, try to minimize your hand movements. If you have to say something, make it slowly. Use a monotone voice. Don't raise your voice. If somebody if you need somebody, don't yell at them, call from them. Sometimes we ask for our coworker, Miss Jones, can you come here? I'm in this room, and then, Miss Jones, can you come here? Can you help me with that? I mean, that's going to be a problem, because this child who is here is going to take that as if it's going to, like, burst out his ears. Okay, so what you should do is use a monotone voice or monotonous voice, which means, you'll be like, hello, how are you doing? Can I help you today? Are you doing okay? So, like that. I mean, in a soft, not too rising, not too low, just go in the same pace. Okay, that's the best way to talk to them, or how you should be talking to them. Limit visual clutter, which means visual clutter means, sometimes there are rooms with TVs are on, or lights and stuff, and everything is like bright and, shiny and stuff like that. Please, make sure that all of that is switched off. Okay. Maintain minimal lighting. Provide the child with a single object to focus on. So which means, if you want to take the vital signs on this baby, on this kid, okay, you are not going to take your, sometimes how we nurses do, we actually keep the thermometer in the mouth, and then we will hold the, the arm to get the pulse rate, and in between we are doing, something else with the blood pressure cuff, or we are putting the blood pressure cuff and also putting the saturation. We try to do multitasking because we are running out of time, right? But for these kids, please do one thing at a time. You are taking his temperature, just take his temperature. You are taking his pulse and respiration, just do that. Okay, do not try to do too many things together. And private rooms away from the busy areas are the best room assignment. Private rooms away from the busy areas are the best for them. Now you understood why, right? Because they cannot take all that senses. It will be too much for them. Now I think that something clicked, right? So let's go back to our question and see if you are going to change your answer or not. There we go. In that case, I'm going to give you that poll once again. You can change your answer if you want to. All right? There we go. Now, which one you think is the answer? You want to see the options once again? Would you like to see the options? Here we go. So the child has to be placed in a private room away from the busy areas. And what are the busy areas usually in the hospital? Nurses' station is the busiest area in a hospital. Kids' play area is the busiest area in a hospital. So what do you think? Where do you think the baby should be, or the 9-year-old child should be? Got it? Here we go. All right. Now you are getting it. Now you are getting it. Yes, the answer is placing the child in a private room at the end of the hallway. Because at the end of the hallway, usually there is minimal disturbances, right? It's mostly quiet, right? And this child needs an area which is calm and quiet, not the busy areas like nurse's station or kids' room. And do not forcibly place them in a semi-private room, because they cannot take that, a lot of other people coming to see the other child or anything like that. Okay, so better to place it in private room away from the busy areas. Okay, so I guess you learned a lot about autism today, right? So that's good. Now, let's go to the next one, all right? Here. A client with generalized anxiety disorder has received a new prescription for sertraline. The nurse should teach this client about which of the possible side effects. Now you might be thinking, oh my God, okay, which one is that? So which one you think is the answer? Got it? Okay. So now I'm going to give you the survey and you can try to answer this and we'll see if you can get the answers. Okay, just try whichever you think. And if I can give you one clue, sertraline is an SSRI, or we'll talk about that. Okay, good. I'm going to give you the survey. So create the poll and use the first one, okay? Use the one which says SATA and just try to answer. You want to see the options once again? I can show you the options once again. There you go. The options once again and the question. All right. So people are very reluctant to answer when it is a SATA question, huh? Options, please. Okay, here are the options once again. So sedation, constipation, sexual dysfunction, nausea, insomnia, tachycardia. And it's a select all that apply question. And you know, in select all that apply questions now, there will be more than one answer, but it can be all of them too. Okay. And please remember, there is no partial credits. You have to get exactly what it is. Okay. Whether you get 2 of them right, 3 of them right, does not mean anything. It's either right or wrong. All right. So let's see. Here we go once again. Go ahead, it's okay. All right, so many of, I think the most answered ones are A, B, C, E, and D and F are like 40%. Okay, all right, let's see. So I'm going to take something from the course, okay? And this is what we talk about, you know, in the course we talk about this one on this one too. It's called Serotonin Syndrome. Okay, but it will help you to understand a little bit better. Okay, SSRIs or the selective serotonin receptive intake, these are the type of medications which are most of the time it is used for kind of mood disorders or depression, and even in anxiety issues it might be used. So really the major problems or major medications I would like you to remember about is these ones. These are the major 5 medications which comes under SSRI. I mean, there is more, but when it comes to NCLEX, this is my way of helping you to narrow down the pharmacological topics and the contents. And if you can at least remember these 5 being SSRI, you'll be so much better when it comes to mental health pharmacology or psychiatric medication. So please remember these 5, okay? Fluoxetine, paroxetine. So if you cannot remember, at least remember Cetine, something which ends in Cetine, okay? There are 2 of them. And there is citalopram and escitalopram. So both of them is like some kind of pram. So setin, pram, and the last one is sertraline. Okay, it's also called Zoloft, but that's a brand name. But now you may not be able to see brand names. You might be seeing only the generic names. So just remember these 5. Okay, so two of them with zetin, 2 of them with some kind of pram, and there is a sertraline. Remember that 5 SSRIs. Okay, now the problems with SSRIs. Okay, remember 5 S's: sleep problems, sexual dysfunction, stomach upset, that's where your nausea and indigestion and stuff comes in, serotonin syndrome, and scale for your weight gain, because long-term use of SSRI will cause weight gain. Okay, so at least this is something which will really help you to understand 5S. Remember 5S for side effects of SSRI: sleep problems, which can be insomnia and things like that, sexual dysfunction, stomach upset, serotonin syndrome, and scale. Scale, which I'm meaning is weight scale, okay, weight gain. It's gain, not lose, weight gain. All right, so will you remember that? That's going to really help you in answering these questions. Okay, now it may take up to 4 weeks for therapeutic effect. So most of the psychiatric medications are like that. They are not going to be all of a sudden. Okay, for the the chemical balance and the mood disorders and everything, it's going to take a little more than 1 or 2 doses. Medications may be taken with food, because you can imagine it actually causes stomach upset. So anything which can cause stomach upset, you want to take it with food, right? Right? So that's the connection, connecting the dots. All right. And sleep disturbances are minimized by taking medicine in the morning, which means if you know that this person, if they take this medicine, they might have insomnia or difficulty falling asleep or difficulty staying asleep. Okay, and it's better for them to take it in the morning, because you don't want to sleep anyway during the day. You want to be active and energetic and doing things, right? So maybe they can take it at bedtime, they can take it, they should be taking it in the morning, because that way, there won't be much disturbances, because they are staying active and that's not going to make them feel sleepy. But if they take it at bedtime, okay, they are taking it at bedtime and they are going to sleep, they will have difficulty falling asleep, and they cannot stay asleep, and they will be very groggy in the morning, and they will be so tired in the morning because they couldn't sleep. Okay, so better to take it in the morning, so they are like walking around and active and they don't feel like sleeping, and that's okay, and towards the night they can sleep better. Okay, so 5S. And you might be thinking, what is this thing, serotonin syndrome? Okay, this is kind of a major problem, because the rest of the things, probably you will be able to manage them. Okay, but serotonin syndrome can be a little more than usual side effects. Okay, so you need to really understand what serotonin syndrome is. And there are certain special signs and symptoms you might see in a patient with SSRI, which will lead you to think about serotonin syndrome. And the best way you can remember it, by remembering hatred fact. Okay, I am somebody who makes lots of acronyms to help the students, and this is something I came up with, and I think it's going to help you to remember the serotonin syndrome clinical manifestations. Okay, remember hatred fact. H is for hallucinations, A is for agitation, T for tremors, R for hyperreflex, reflex hyper. E is for easily distracted, or you can say in another words is difficulty concentrating. I mean, you won't be able to concentrate, you get distracted so much. Okay. D is diaphoresis, which means excessive sweating. F for fever, A for anxiety, C for confusion, T for tachycardia. Okay. Now, confusion in your question maybe does not say confusion. It might say disorientation. It might say, not oriented or something like that. So just remember that. So hatred fact is the one which kind of manifests the serotonin syndrome. Usually begins 2 to 72 hours after starting the treatment. And the way to stop this is to stop the medication. And when you stop the medicine, you have to come down slowly, taper it down. And you have to actually teach the patient to see if there is any of this clinical manifestation, and then they have to actually report it immediately. Okay, so this is something you are going to teach. This is health promotion. All right, very important. So 5 things, 5S. Remember 5S? The previous slide which we talked about. Sleep problems, sexual dysfunction, stomach upset, serotonin syndrome, and scale. And serotonin syndrome, how do we know that? That is our hatred fact. Okay, so if you know this, can we go back and do our question once again? Okay. Because now you know what SSRI side effects are. And now you know that sertraline is an SSRI, right? Remember these ones too, something with zetin and pram. Fluoxetine, paroxetine, citalopram, escitalopram, sertraline. There we go. Sedation. Did we talk about sedation here anywhere? No, because sedation is usually an anti-anxiety medication side effect. Okay, we don't have sedation. Constipation. Did we talk about constipation? We talk about GI disturbances, right? But that's usually nausea and gastric distensions. Okay? No constipation there, right? Sexual dysfunction? Yes. Nausea? Yes. Insomnia? Yes. Tachycardia? Yes. So let me show you it here. Okay, here, sleep problems. Okay, so there is insomnia here, which is a sleep problem, right? And there is stomach upset, and that is your nausea and gastric distension. Yes, that can be there. Okay, sexual dysfunction, that's there. And in serotonin, we said something here which says about tachycardia. Do you see that? Tachycardia. So in the question, we have tachycardia. All right. So remember those shortcuts. That will help you to actually answer the side effects and signs and symptoms of most of the diseases, and that will really help you. Okay, so SSRIs are one major group of medications which are used in, especially in depression. It's used in mood disorders. Okay, and they have side effects, and the side effects are this. All right, there we go. Okay, all right, and I think we can do one more. So there's a female client who is brought to the emergency department after the husband find her with lacerated wrist, a cut. All right. So the spouse says, if I hadn't come home early, my wife would be dead. I can't believe this is happening. What is the best response by the nurse? A, is there any family or friends who can help you with this situation? B, does your spouse has a history of mental illness or previous suicidal attempts? C, this has been very overwhelming for you. What are you feeling right now? D, I'm glad you were there at the right time. Focus on the fact that you saved her life. Got it? So let me give you the poll and see if you can find the answer. And to see the options once again. Just going to give the options once again. And please stay hydrated, okay? Okie dokie, here we go. Okay, all right. Go ahead, it's fine. Answer it, please. It's okay. Okay, nobody is answering A. So I think everybody are like, no, it's not A. No. Okay, there's lots of C, lots of D, and there is some B. Okay, so let's see. Okay, so the people who said C, that is the right answer. Okay, this has been very overwhelming for you. What are you feeling right now? What are you feeling right now? That is the answer. Okay, now this is about therapeutic communication. This is a crisis situation for this husband. Okay, because he came home and he found his wife, both wrist cut off, lacerated. Possibly she was trying to, like, maybe attempting a suicide, maybe, we don't know, but that happened and he took her to the hospital and he is overwhelmed. This is a crisis situation for him, and he is saying, if I hadn't come home early, my wife would have been dead. I couldn't believe this is happening. I mean, that is something like a situational crisis. Okay, so in that case, we don't want to use any kind of closed-ended questions. Now, we talk about therapeutic communication a lot in detail in the course, and you might be already, some of my students already know that, but there is entire session dedicated to therapeutic communication. So if you have any question, please go back to that session, okay? That's a very important mental health concept, okay? So in that one, remember, we are not going to use any kind of close-ended questions when we try to talk to someone in crisis. Okay, you have to acknowledge their emotion. You have to acknowledge what they are going through, and do not give any personal suggestions. Now, is there any family or friends who can help you with this situation? Yes or no, which means it's a closed-ended question. We don't want to use that. Okay, maybe the intentions of the nurse is good. She wants to see if there is someone who can help this person because he is all alone and overwhelmed. I understand that, but that is not the right thing to say in NCLEX way. All right, because in NCLEX there is always the good answer, the right answer, and the best answer, and you go for the best answer. If not, it's wrong. Okay, so even though the intentions are good, this is a closed-ended question. We are not going to use that in therapeutic communication. Okay. Again, the same for the second one. Does your spouse has a history of mental illness or previous suicidal attempts? Many of you answered this as the answer, but I know what is going through your mind, because she found, she lacerated the wrist, which means probably she is attempting a suicide. But we also don't know if somebody came, like a robber, or robbery is happening or something. We don't know if somebody did that to her. We don't know, right? It doesn't say in the question. It's just that we assumed that, oh, okay, this might be a suicide attempt and we're talking about mental illness, so this should be some kind of suicide. Who told that? That's our overthinking. So, well, do you want to know about the previous mental history or illness, something like that? Yes, but it's a closed-ended question and we have a better option. Okay, so does your spouse has a history of mental illness or previous suicidal attempts? Is that going to help this man? No, it's going to make him think even worse, right? So that's not our answer. C is the right answer. This has been very overwhelming for you, which means you as a nurse is actually letting the patient know what he's feeling. Okay, he is definitely overwhelmed by what happened, right? So you are like, actually, this is something called empathy, and empathy is okay. Sympathy is not okay. Okay, So this is good, saying that you know what's going on. You're kind of trying to make him feel what he's feeling. But what are you feeling right now? You are trying to identify. Okay, you're trying to identify what is going on, what is the actual emotion he is feeling. You're trying to help him out. Okay. Now this is not a closed-ended question. See, I'm not saying, oh, this has been very overwhelming for you. You are feeling anxious, aren't you? Now, that is wrong. Okay, when I say that, that becomes a closed question. Or, oh, this is very overwhelming for you, right? I mean, are you feeling very depressed now? I mean, that's again a closed-ended question. So that's not the way you are going to talk in mental health therapeutic communication. Okay, and we go in detail about that in the course. So please go back to the course and listen to mental health that entire week. I think it starts from there 31, 32, 33, 34, 35, 36, and there is a lot of exams and reviews, and there are videos where I explain more in detail. So please go back to it, because 12% of your questions are going to be mental health. Okay, and you have to be above the passing standard for psychiatry, psychology. You have to get there to pass NCLEX. So please take best use of those videos. All right. Okay. And the last one, I'm glad you were there at the right time. Focus on the fact that you saved her life. I mean, that is not focusing on the patient, on the husband's emotions. That we are not focusing on the patient feeling overwhelmed, not the patient, the husband feeling overwhelmed. Okay, we are just trying to just go by. Oh, I'm glad you were there at the right time. Okay, let's focus on the fact that you saved her life. Now let me go. So that's not helping. You are not really helping the husband. He is like in a situation where it's a crisis, right? So what is the best answer then? It's C. All right. So C is what you're going to look for. Okay. Now, I think we are almost getting into the last hour, last minutes here. So I want to say thank you to all of you guys who came here today. And I know there is many more people who actually registered too. And some of you guys couldn't come in because our room is full. But you guys will be getting the recording. I mean, this will be in the YouTube too. So probably you will be able to see that. But like I said in the beginning, things are going to change. So please take advantage and prepare better. Because for any international nurse, it is always higher chance of passing the first time. Okay, as of July, I think we have the reports till July that the passing rate is around 45% for the international nurses for the first time. But if you are the second time, it's 28% now, I think. Okay, so which means you have to really work hard and stay committed, and not just the theory but the application too, so that you can actually make it this time. Okay, now I keep you in my prayers, and just like I said earlier, once again, തിരുവോണ ആശംസകൾ എല്ലാവർക്കും, and thank you so much for praying for Kerala, because we actually had a very bad episode of a flood, but we are recovering. Thank you so much for all your prayers and all your wonderful donations and everything which you have done for the government, and for the people. So keeping you in my prayers, and please keep me in your prayers too. So I will see you. And like I said, I'm going to North Carolina for the NCLEX conference, and I am very happy that I got the admission to it. So I should be learning a lot, and I'm excited about learning a lot directly from NCLEX people. So I will have the first-hand information. That's always the best one. So all the best. Stay tuned, and I will see you later. Thank you.